Hello, everybody. Welcome to the Psychological Resilience broadcast. This is one of a series of broadcasts in which we're looking at work being done with between SLAM and community partners to think about the great work that's going on in the community to develop and support the mental health of our local population. And today we have a really exciting opportunity to talk to a primary care network GP and a community consultant about the work going on in Stockwell, which I hope will be informative for anybody wherever they are working across the integrated care system, and to think a little bit about how the work of mental health can be done differently if we work together in partnership. So these broadcast series, if you've been joining them, really investigate different ways of working with primary care, ways of working with third sector providers, ways of working with other community assets, so that we can think together about how we can address health and social care inequalities, and we can build on that resilience that our local communities already have to help them to help prevent the development of mental health problems. So without further ado, I'm going to ask our participants to introduce themselves, but we're having some technical difficulties, so you'll please bear with us. If you have any questions for anybody at any stage, please do post them in the question and answer, and I will endeavour to ask them directly to the participants. So, Vic, could you introduce yourself, please?
Thanks, Alison. Hi, I'm Vic Sharma. I'm a GP partner at the Grantham practice in Stockwell, and I'm clinical director for the Stockwell Primary Care Network. And what sort of brought me to this today is I have a real interest in community assets and growing networks from the grassroots up. I've had quite a bit of experience working with the Portuguese-speaking community over the last 5 years around health inequalities that they suffer, and that's led directly to the stuff I'm doing now with Thriving Stockwell, which I'll talk about.
Thanks, Vic. And Will, would you like to introduce yourself?
Oh, hi everyone, my name's Will Nicholson. So I work as an independent health and wellbeing consultant, connector, network facilitator. My passion is community and bringing people together from all different backgrounds who have an interest in those things: community, health and well-being, and that's a huge range of different people, not just the traditional system in terms of the NHS, but the local voluntary community sector, local volunteers, working with local businesses, housing associations and schools, to all sorts of people that share a passion for partnership and health and well-being.
Fantastic, Will. Maybe I can start with you, Vic, and ask you about the vision you have for your primary care network regarding the health of your local population.
Yeah, so it's based really on sort of a couple of premises. One is the emergence of how much evidence there is, right, around social determinants and how they impact health outcomes, quality of life, mortality. There's a lot of strong evidence out there now about that. And the other thing is, in general practice land, there is consistently studies that come out showing how many GP appointments could have been handled better elsewhere. So when you sort of audit GP appointments, you often see anything up to 40% of GP appointments could have been better seen somewhere else outside the general practice surgery. So with those sort of two things in mind, I've been really interested in figuring out actually redefining a little bit what my role is. So, we're quite disease specific as clinicians, but actually with all the evidence out there now, we need to start thinking about health and wellbeing in a slightly different way and what our role is in that. And so I'm really interested in how we integrate with the other people in the community that will help us deliver the health and wellbeing we need to our patients in the most holistic way, so that we see the people that we need to in general practice and use our expertise to the best we can, which is around complex patients and frailty and multimorbidity, and also patients and residents are seeing the right people at the right time for the help that they need. So that's the premise of what I'm trying to figure out and solve. And so to start us on that journey, we've created the sort of the Thriving Stockwell movement, which is a coming together of the PCN, the Primary Care Network, which is 5 GP surgeries, with lots of other community stakeholders, including housing, local council, residents associations, faith-based groups, local individuals and volunteers, really to create quite a proactive, positive space for us to sort of speak about health and well-being.
Oh, so that's really interesting. So presumably the premise is then that engaging all of these local assets, you can really ensure that people receive support where, you know, locally, but also it can free up some of your time to focus on perhaps that complexity and that frailty that really only a GP can do. So could I just ask you a little bit more about, you know, this journey that you're on as a PCN? Is that something that all PCNs are on? Is that, are you similar? Are you different to other PCNs?
I think we're all on that journey. We're at different stages. So the reason I became clinical director in Stockwell, the reason I put myself forward, well, there wasn't anyone else putting themselves forward, but also I was really sort of motivated to see what I'd been doing at grassroots level with the Portuguese speaking community, if I could transfer that learning to a neighbourhood level. So how do you build a network at grassroots level where you've got different experts, different perspectives coming into a room trying to solve complex issues? And I really enjoyed that and valued that. So I wanted to see if I could bring that to a neighbourhood. So I think we're probably a bit further down the line in sort of embracing that way of working and thinking. But as far as, is it something that all PCNs are thinking about? Yeah, it's part of our mandate. You know, so PCNs initially are defined as the GP surgeries, but long term, the vision is for PCNs to integrate with the wider community in that neighbourhood. So we're all trying to figure it out.
So that's brilliant. Will, can you tell me how you come into this? And so how did you and Vic, you know, come to a meeting of minds around Thriving Stockwell? How did Thriving Stockwell come about?
So it's very much just what Vic said there about that long-term vision, or the big vision for PCNs around community, and I think well-being in its broadest sense. Because we know from, like, not just the social determinants, there's so many factors that influence people's health and well-being. Sometimes it is a medical issue, but often it's a real wide, complex range of social, economic, environmental factors that affect it. But what really brought us together was that vision is shared across so many different people working locally, local people, schools, housing, you know, faith groups, like Vic was describing. And what brought us together is that so many people, I think, want to support their community, have so much to contribute to health and well-being. It might not be directly, you know, a specific health issue, but have so much to support in terms of those other factors. And that sort of richness of asset that it was just really hard for people to connect. So Thriving Stockwell, for me, was something that, you know, and working with Vic was a great opportunity for us to bring together amazing people that already exist in the community who are doing really great stuff, so that they could share with each other what they were doing and start to provide those different perspectives. It's like, oh, I've never really thought about approaching that problem from that angle before, or that what you offer is one of my hardest things is you know, outreach into a certain community, and I haven't realized that is your bread and butter, for example. So we started to, you know, that's the passion behind this, the shared vision, and that so many people have something to contribute towards it.
Could you give us an example of that? Because you've described about you know, the multiple assets and the ways in which you can reach, but I'm imagining that could be quite a noisy piece, quite a lot going on, lots of people offering different things, and the difficulty is how you get to a clear vision of what you're going to do in terms of the health of the local population. Could you talk a little bit more about how you achieved that, and maybe, you know, one area that you've thought, here's a piece that we could do? So you said, for example, reaching into the Portuguese speaking community, but there might be another example.
Yeah, I mean, there's so many different ones I could join. I think one that we're working on right now is around open and green spaces, and from a health perspective, the sort of health driver is physical activity, and supporting people to live sort of healthy lifestyles. But then what we suddenly realize is that there's a lot of people looking at how they can support their community to keep active, keep healthy. So the local school, which is right next to two of the GP surgeries and Vic's PCN, are also looking at how they can support their children and their families to keep active. Hyde Housing, who sit right in the middle of all of this and have 3,000 residents in Stockwell, are looking at how they can better use their spaces in their estate to facilitate better connections between their residents, reduce antisocial behaviour, have more active people, because their residents who are well and connected, have a much better experience of Hyde as a housing provider. And suddenly we all came together and we went, there's so many other groups that are interested in healthy living through greening, green spaces, gardening, and that project in itself is really hard to bring together, but through Thriving Stockwell, we were able to convene just a wonderful group of 15 people who all had an interest in health and well-being through physical activity and gardening, but had so much to contribute from different angles, and not just the direct health drive for it, but that created almost win-win for everyone involved.
So we've had a community gardening project on this broadcast series before, although that was over in East London. So it's really interesting to hear that something similar is going on very locally for us, and I think the opportunities for thinking about that, in other boroughs is really interesting. We haven't managed to have Graham Gardiner, who was going to join us here from Age UK, join in because of technical difficulties. But I'm just wondering if I can, and I know both of you could pick this up, but maybe if I just turn to Vic, can you tell us a little bit about how Age UK work with the PCN, and maybe also with, are they then a typical example of a Thriving Stockwell partner, or are they somehow different?
Yeah, sure. So I suppose it's important to then talk about social prescribing. So social prescribing is going back to this point about social determinants and the evidence that's building up around it. I suppose social prescribing is NHS England's first attempt at walking into that world of how do we actually break down this barrier between NHS institutions and the community. And so we've so all primary care networks from last year, 2019, have been given funding to employ at least one social prescriber link worker. But we can employ more, and the hope is that we can employ up to 5 over the next 3 to 4 years. And their role is to be employees of general practice, but build relationships with local community assets, and be a point within the practice where, when we as doctors or clinicians identify patients who do have larger socioeconomic issues going on or other social issues going on that are holding them back in their health, that our link worker can step in and support them and signpost them or work with them for a short period of time to get them sort of dealing with the other stuff that's going on in their life, so that they can then focus in on their health. So social prescribing is up and running across the country, and in Lambeth we made a concerted decision at the beginning that as 9 primary care networks across the borough, we wanted to have a unified approach, because we really wanted to capture the value of social prescribing, and the risk was if we all went off and employed our own link workers, you wouldn't get that. So we asked Age UK, who've got a lot of experience locally and good working relations with us in Lambeth, to be the sort of the third-party provider for us in Lambeth, to recruit, employ social prescribing link workers. And so that's what they've managed for us, and is going on at the moment. And that relationship worked really well, for example, during COVID, when we had the shielded patients, in that we could rapidly adjust our social prescribing offers to make sure all our vulnerable shielded patients were getting the support that they needed. But yeah, we're doing some really great work with them sort of long term. And the exciting thing with Age UK is they've got their My Community sort of directory of support, right, which is all the stuff that they do with handymen and befriending services and all the other services they offer. And that's been a borough-wide offer, but they are now looking at sort of mapping that onto PCNs or neighbourhoods. So you'll have sort of localised directories matching to PCNs as well. So you will have a PCN, you'll have the local community assets, you'll have a link worker, and then you'll have a local directory that's mapped onto that as well. So quite a nice way that we're evolving. And at the same time, at borough level, we're capturing data so that we can start to build up evaluation and sort of impact on wider system of how social prescribing works.
Thanks, Vic. And so you're talking about these directories of services which would be local to a primary care network, and as you say, there are 9 across Lambeth, so quite local groups, and they presumably are something like the community assets of that local PCN geography. How are they similar or different from Thriving Stockwell? Will, maybe could you answer that, or no?
Yeah, so there's an overlap. I think the thing with Thriving Stockwell is that it's about the relationships. So having a directory is really useful and helpful in terms of knowing a lot that's out there, but a lot of barriers to then accessing those services and accessing the right thing. It comes down to trust and relationships, that connection into the community. And so where Thriving Stockwell comes in, it's an active network of people who aren't just a name on a directory, who are also able to then support that group or that person to access a service, and that could be through language, it could be a cultural issue, it could be logistics and actually helping someone to physically attend a meeting or sign in digitally. So it's the combination of these things. That's why AGK is a fantastic partner, because it has both borough-wide activities, which we know are hugely important for people, because not everyone just lives in their own neighbourhood, but it also has that neighbourhood focus, and then almost connecting together Thriving Stockwell, which is the neighbourhood network of organisations and individuals that can help, facilitate people accessing the things in the directory.
So I think I understand that. So that's really what you have brought into Thriving Stockwell, isn't it? That the connecting of people together and the injection of energy into that relationship building. But I imagine that's a piece of work that really everyone who engages in this work has to undertake. It's all about building relationships, I imagine. And I wondered if you could tell me a little bit about your journey in terms of building those relationships. So I imagine that in the audience we've got quite a few people who say, this is really sensible stuff. I can really see how, we need to think about, bringing all the community assets together to make sure that we can work together more effectively. But how do I start? How do I go about doing that? So I just wondered if you could talk a little bit about your journey here and where you started and how you got there. Vic, can I start with you?
Sure. Yeah. So I think for me personally, first there was a recognition or a self-awareness of the power that sits with NHS institutions and doctors and clinicians. Like it just is inherent in the way things work, and that's reflected through communities. That's why people come to a general practice when they're feeling like they need something, or that there's something affecting their well-being. There's only a couple of places that they think that they can go to get help, and so there's something about, if you want people to understand that they can go to other places and there's lots of other experts that can help them, there's something about how we share out that power. So I personally went through a bit of a sort of a messy, uncomfortable journey where you're actually trying to share out that power and actually sort of bring other experts on along who work in a different way, who approach problems in different ways. And it can be a bit messy and a bit disconcerting at times because you're used to working through your training in a certain type of way. But I think it's a journey that really is worth going through, because at the end of it, you start to see the value from what they bring and how they offer different solutions. And that's really blown my mind at times of some of the ways we've approached things. And then once you do that, then my role has very much been about advocating, really. So all this amazing work that's going on at grassroots level, what people on the grassroots level often don't have is the systems thinking or access to the table or the decision makers or the conversations where policy are discussed and things like that. So I've really sort of tried to make sure that those voices are heard and actually bring them to the table as well, so that they're part of the conversation. And so then through that, you create sort of more of an equal setting then in how you work together. And that's when you start to get the benefits of the partnership, because then you've got that trust there, you've got those relationships, and then you can start to actually share out some of the work and start doing things in a new way. But you're right, you need to invest a lot up front first in that relationship building.
And it strikes me from what you're saying as well, you've got to be prepared to relinquish some of that specialness that comes along with being an expert provider, a doctor in your case, or another kind of expert provider, and start to be able to see the value that others bring to this piece. And there's a question from the audience about which I think is trying to get underneath. Surely if people come to see their GP, they come with a medical problem, don't they? And their medical problem needs to be treated by a GP. Can you just elaborate a little bit more about how you came to the realization that actually quite a lot of what goes on of the work of a GP could be done by someone else?
I think it's really well recognised, to the point that, when we do our training and we do our sort of end of GP training and we have to do our practical exam, we do role plays. Part of the way we prepare for those role plays is what's the hidden agenda. That's what we get marked on. So, we'll have the patient coming in the role play saying, I've got a headache, and we will only get marked and pass that exam if we figure out that actually it's because they're not sleeping well, because they've broken up with someone 6 months ago and they're feeling really lonely and all of that sort of stuff. So it's fundamental to the way how general practice works. People are attracted to general practice because we often talk about us being working as contextual diagnostics, so as diagnosticians, so that it's not just talking about disease, but putting in the context of the person, their family, the community. So that's embedded in how general practice works. The issue is then having to, as the world gets more complex and there's more morbidity and more demand, is figuring out which part of that spectrum we as GPs are most useful at and best used for. And that's the transition we're going through at the moment. So I think, ultimately, I'm trained in and can deal with multi-morbidity, long-term conditions, complexity, frailty, and yes, be aware of all the other social determinants, but I can't sort those things out. So that's where I need to work with other partners.
So I guess there's kind of an invitation there for secondary mental health practitioners to also think, in much the same way. And I'm not sure it was always certainly wasn't part of my core training to think how, what else might people be presenting with here other than a need for psychological therapy, and who else might be better suited to meet that need than me. For me, it's been a journey to realise that we're all part of a much more complex landscape, and we need to work much more closely with each other to understand actually there may be somebody better suited to helping or working with this particular individual than me. Will, I just wondered about you and your experience in terms of your journey towards making, in this case, Thriving Stockwell happen, but I know you've done it before and I'm sure you'll do it again. So can you talk to us a little bit about that?
Yeah, I think in some ways I summarised it in terms of what I'm really passionate about, which is the things that we have in common, and the sort of the sharing of not just problems, but how we share, how we resolve things. And I think what you discover is that, we are deeply social and in theory, mostly cooperative and collaborative in our nature as humans. And what's really hard is to find that time to find out who else is out there, to trust what they're doing, to have the opportunity to understand how they can contribute to something that you could resolve, or that you feel comfortable dealing with. And so what I've been on a journey with is just helping people to build those relationships to, in some of those examples that Vic was giving, how on earth do you find someone else that you could trust that could resolve whether it's that factor supporting someone with a relationship breakup, or supporting someone with a health or a housing issue that's affecting their health. And then on the other side, it's helping that person realize that there's a lot of value in working with someone like Vic, and there's a lot of value working with mental health services as well, because you have a relationship with that person, you have so much to contribute to helping that person as well. So it's sort of changing the nature of the conversation away from competition and separation, and just saying, what, actually together we can solve so much, and it's really uplifting for you as an individual, as well as a lot of operational and synergies that come with it. So the journey really has been an enjoyable one, just bringing people together that have so much in common.
So a kind of a question to both of you really around where else is this happening? Is this just a Stockwell phenomena? Are you sort of world leaders in this, or is this going on elsewhere? Do you know of any other examples?
Yeah, I think for me, so this is happening everywhere, in so many different settings. I think that there are there'll be networks within South London and Maudsley where you'll get groups of clinicians that will come together and want to share across departments, and so really it's just the culture of a way of working that recognises the value of the individual and the specialism, but recognises that in order to resolve things, that there's a really great strength in doing things together and having those different perspectives. So you'll see that within your own organisation, in your own teams, but also in loads of different projects. I suppose the most well-known one is like at Bromley by Bow, as an example, where that has been going for 35 years, where all sorts of different partners from different backgrounds have been working collectively, brought together in a physical space around the centre. But I mean, I could just go on for hours listing different types of things, but yeah.
But thank you for giving us a taster of that. That's really helpful, Will. And again, sort of, can you tell us a little bit about what you think mental health can bring to this piece? How can a mental health practitioner really help you on this journey, be part of this experience? What would be your recommendations, Vic?
So a couple of things, I think. There's two things we're trying to do in Thriving Stockwell then, right? So we're trying to empower and build capacity within our community assets so that they can see patients or residents that would normally have come to us first. But they need to have the ability and the confidence to support people going through mental health issues, stressors, and be able to support them in a way that's safe and right and things. So it's about how we can how the mental health world can support that community to do that. But then also remember what I was saying, it helps then free up GPs to deal with the patients that need our support, and some of those patients are mental health patients. So we've got complex patients, personality disorder patients, asylum seekers with post-traumatic stress who maybe never sort of get to sort of secondary care, but are constantly being seen in primary care, and we feel so like we've not really supported them as much as we can because it's just a bit beyond our sort of capabilities, and it'd be great to have some support in practice supporting with those patients. And then the third level is stuff that we've always tried to do before but never really quite nailed, which is that step down sort of care for patients who are in secondary care, who are coming back into primary care, actually building a really nice sort of package around that. So I think there's three ways that would be great for us to get support from the mental health team. And I'd put that in the context of, I'm not sure if people are aware, but from April 2021, primary care networks will have money to employ a mental health professional. So just like we've got link workers and pharmacists working in primary care network, in a few months' time, we will be looking for mental health professionals to employ. And I think this is an important time, and this is, I think, a good reason we're having this discussion today, is we should have that discussion. What should that role look like? Should that be tailored to different PCNs? Is there key components that should be to each PCN? So yeah.
Well, sadly, we've run out of time. It's been a really interesting conversation, and we've had loads of questions from the audience, which I can't begin to ask you all of them. But thank you so much. Thank you, Will, and thank you, Vic, for joining this broadcast. This broadcast will be available on the website for anyone to download and share after the event, and it will have your contact details in should anyone have any questions for you. But thank you once again. It's been fantastic.
Yeah, thank you. Bye, everyone.